Meanwhile, the South American nation Peru has temporarily suspended the clinical trials of the Chinese COVID vaccine Sinopharm. This after Peru detected what it describes as neurological problems in one of its test volunteers. Now, according to local media, Peru's National Institute of Health interrupted the trials after a volunteer had difficulty moving his arms. The chief researcher, German Malaga, said, and I quote, "Several days ago we signalled, as we are required to, the regulatory authorities that one of our participants presented certain neurological symptoms which could correspond to a condition called Guillain-Barré syndrome." Now, Guillain-Barré syndrome is a rare and also a non-contagious disorder which affects the movement of the arms and legs. Now, Peru declared a temporary health emergency in 5 regions in the month of June following multiple cases. The Guillain-Barré syndrome can cause paralysis and can be fatal if it is left untreated. In the 1970s, a campaign to inoculate Americans against a strain of swine flu ground to a halt after some 450 of those who were vaccinated developed this syndrome, which can also cause paralysis. The Peru's clinical trials of the Chinese pharma giant Sinopharm's vaccine were due to conclude this week after tests were conducted on at least about 12,000 subjects. The Peruvian government was expected to buy nearly up to 20 million doses to inoculate 2/3 of its population in 2021. Around 60,000 people around the globe have already taken the Sinopharm vaccine, including volunteers in other nations such as Argentina, Russia and Saudi Arabia.